to recognize the presence of our Honorable Magahaga, Governor Leon Guerrero, as well as our Segundo Magalahan Guahan, the Honorable Joshua F. Tenorio. Also with us today, we have the Director for the Department of Public Health and Social Services, Arthur St. Augustine, and Department of Public Health and Social Services Chief Medical Officer, Dr. Felix Cabrera. I would now like to give the floor to Governor Leon Guerrero for her remarks.
Thank you very much, Crystal. Good afternoon and half a day to the people of Guam. Nearly a year ago, we began our battle against COVID-19. On March 14th, I declared a public health emergency. A day later, we confirmed our first 3 cases. A week later, we reported our first soul lost to this virus. As you can see, the progression of this virus was not very favorable. And as a result, we had gone through some very serious challenges this last year and continue to have that challenges. Today, I want to thank our people for meeting those challenges. It took each and every one of us and everyone's cooperation to contain the spread of this virus and to flatten the curve. You stayed at home when I asked you to do so. You wore your mask when the experts, based on science and data, said that wearing masks would help contain these viruses. You washed your hands and you watched your distance. Together, we overcame not 1, but 2 surges and lockdowns. Late last year, we implemented the CAR score, which is a unique scoring system and a metrics to Guam. It was created by Dr. Felix Cabrera, and the CAR score was a single number that could help us understand the effectiveness of our response. I asked you to strive for 5. You listened, you cooperated, and you acted. Together, we brought the CAR score to 5, I think as high as 47. And we maintained a CAR score under 2.5 since the 2nd week of December. With a low CAR score, we saw a drastic decrease in hospitalization. It peaked at 102 late last year. Today, we have 5. This is possible because of regular testing, which helps us to trace and treat all new cases. This is possible because of mandatory travel quarantine, and this is possible because of aggressive vaccination efforts. Now, over 16,000 in our community are fully vaccinated. I promised that with progress, we could see fewer restrictions. Today, I will be signing Executive Order 2021-04 to transition our island from Pandemic Condition of Readiness 2 to Pandemic Condition of Readiness 3 that will take effect on Monday, February 22nd at 8 a.m. This means most businesses and activities will be permitted to operate under moderately restrictive conditions. On Wednesday, February 24th at 5 p.m., bars and taverns will be permitted to operate at no greater than 50% occupancy and subject to public health guidance. On Monday, March 1st at 8 a.m., non-contact athletics may resume competition again, subject again to public health guidance, to include limits on spectators, requirements for sanitation, and wearing of masks whenever possible. Early in the pandemic, we instituted a local eviction moratorium, which was followed by a federal eviction moratorium to contain the spread of COVID-19. This was a temporary measure. Rent is still due, and I encourage everyone to work together to establish payment plans. In light of rental assistance and continued federal protections, we are moving to lift our locally imposed moratorium in phases so that landlords adversely affected can begin their recovery. The moratorium on eviction proceedings as it pertains to residential property for reasons unrelated to the failure to pay rent, such as damage to property and criminal activity, and also commercial property shall be lifted effective March 1st, 2021. Landlords are still required to give 30 days notice. While I have lifted additional restrictions, our battle with COVID is far from over. We have been here before, and we know all too well what happens when we let our guard down. I am asking you, as we gradually reopen our island, to always wear your mask, watch your social distancing, and wash your hands. These are the very simple public health prevention measures that have gotten us through this god-awful pandemic. I am asking for your cooperation so that we can continue to contain this virus in our community. Thank you, and Sidhu Smasi.
Thank you, Governor. I now like to give the floor to Department of Public Health and Social Services Chief Medical Officer, Dr. Felix Cabrera.
Yes, okay, much better. Okay, our CAR score is 0.1, and as you can see here on the left part of the graph here, basically what we've been through since August, and where we've had multiple peaks at 26.8 and 24.5 in October, and then the highest of 46.8 in the middle of November. But as you can see, we've been able to get below 5, and have been at by the second week of December been below 2.5 and have maintained that throughout. And the three variables that make up our CAR scores, primarily the test positivity rate, which right now we're at 0.7%, the effective retransmission value, which right now we're at 0.7, so below 1 is where we want to be. And our daily new cases, and these again on a 7-day rolling average, is at 2.7. So all in all, our total cases right now is 7,705. Those that are still in active isolation, there's 47. Total COVID-related deaths, 130. Active hospitalizations, 5. A 7-day rolling average of the daily test that we perform here on Guam, it's still relatively high, and it's at 368. A case doubling days. In other words, if we were to double the amount of cases we have right now at the rate we're going, how many days would that take? Well, it will take us 896 days, which is great. We want that number to be as high as possible. And when comparing to other jurisdictions, we look at our daily new cases per 100,000 persons. And so at a 7-day rolling average, we're at 1.6. That makes us and the Northern Mariana Islands the best in the country in states and territories. So what will be reported in tonight's JIC is these vaccination numbers. So we've been able to give out 45,766 vaccinations on Guam. And the first shot, that's 29,710. That represents 17.7% of the population getting their very first shot. And overall, there have been 9.5% of our population who's been fully vaccinated. And right now, on a 7-day rolling average, we give out about 828.6 vaccinations per day. So this here tells the story of where we've been through thus far. The brown line represents our CAR score. The purple represents the hospitalized COVID patients. The dotted purple is the 7-day rolling average that represents that census. And then this metric here, this gray shaded area, is basically on this day, how many deaths were there in the past 14 days. And so that's what number you're seeing here as it rolls forward here. And as we can see, the correlation with the CAR score and the hospitalizations overall, and then the number of 14-day COVID deaths. And as we got our CAR score down and got it below 5 and even below 2.5, you can see the subsequent decline in hospitalizations and as well as a subsequent decline in deaths, which is our ultimate goal, and how we've maintained that. And then as of the declaration of PCOR3 on January 18, we've continued to have a suppressed CAR score, and then have seen even further decrease in deaths overall, and hospitalization numbers as well being below 10 or around 10. This last slide here just kind of gives us a perspective of where we've been since, especially our CAR score peak of 46.8, and that was on November 15. That was 97 days ago. It's been 83 days since we've been below 5, and 79 days since we've been below 2.5. And even more impressive is 1.0 or lower. That's been 31 days that we've maintained that. And as you can see, the correlation with the hospitalization, our peak hospitalization was 102 on November 2nd, and that was 109 days ago. We rapidly got that down below 50, 88 days ago, below 25, 60 days ago, and 10 or lower over the past 24 days. And then how that correlates with deaths. At our peak on November 26, we had 22 days in the 22 deaths in the 14 days prior. November 26 was Thanksgiving's Day, and that was 84 days ago. And with the efforts of rapidly bringing down the CAR score and our hospitalizations, we've gotten to the point of having below 15 deaths over a 14-day span. And that was 80 days ago. And then below 10, 76 days ago. And then over the past 18 days, we've had 2 or less, which has mostly been 1, deaths within the past 14 days as we rolled through. And so this is a basic summary of how we correlate the CAR score with our hospitalizations and our deaths related to COVID. And this is the end of my slides. Thank you.
Thank you, Dr. Cabrera. We now like to open the floor for questions from our media partners in the Zoom room. Maureen Maritita from Mariana's Business Journal.
Good afternoon. Can everybody hear me? Can you hear me?
Yes, Maureen.
All right. Governor, question for you, please. You have said that in PCOR3, restrictions would be lifted gradually. What do you foresee as the next move that you are likely to be able to approve?
So the next move that I'd likely consider are modification of the quarantine protocols. And we are already with the surgeon cell and other experts looking at what that might be. And so that's something that we are looking at as the next step. And also senior centers. We have not yet lifted restrictions on the senior centers.
Okay, thank you. So do you foresee that modification of the quarantine protocol being for visitors from our tourism markets?
The modification for the travel quarantine protocols are going to happen for all visitors coming in and returning residents, for all travelers. That's why we are calling it travelers quarantine protocol.
So just to clarify, if somebody was coming back to the island, what would that mean? They would quarantine at home, or they would only have to quarantine and take a test on day 6?
They would probably be required a PCR negative test. And then if they are not, if they don't come with a PCR negative test, we would probably put them up in our quarantine facility and get them tested the next day. And then they can quarantine at home if they are negative.
But they'd still be required to quarantine for how long?
At home, about, I think 7 days. Yeah.
Thank you,
Okay.
Maureen. We'll come back
Thank
to you
you.
for another round of questions.
Thank
Steve
you.
Limtiaco from Pacific Daily News.
Yes, hi, good afternoon. So my question is, what will change on Guam if we hit the goal of 70% vaccinations by July 21st? I mean, what will liberation from the pandemic look like initially and long term?
Yeah, you know, Steve, of course, all our work is geared towards totally opening Guam and to try to get back to some normalcy. And that's what I expect. I expect, and I still see mandating of wearing masks, social distancing, and washing hands for about a few more months. And then also we will continue to do surveillance in our community with testing to make sure that we are still within the metrics of containing our virus. And of course, more vaccinations and moving forward. We're not gonna end at 80%. We're gonna work very hard to try and get as many more people to be vaccinated.
Sorry, do I have a follow-up question or?
Go ahead, Steve.
Yeah,
We'll do this round and then come back.
Yeah, so again, on the issue of getting as many people vaccinated as possible, the CNMI governor today announced that he's mandating executive branch employees in the CNMI be vaccinated unless they have medical or religious reasons. What are your thoughts on that? Is that something you might consider here?
You know, mandating is a little bit of a sensitive issue. I really don't feel that if people do not want to take the vaccine for whatever reason, is that they shouldn't take it. If you look at immunizations mandates for, say, kids that go to school, that's by law. That's not by administrative mandate. And so that's a very sensitive question, Steve. And I know that private companies have been asking the same thing. I think what we should do is exert all our efforts to try and persuade people to take the vaccine because for their own for their own protection and for their own safety and maybe, and also for the community's safety. Mandating is something that, like I said, is something very sensitive.
Thank you, Steve. Next, we have Oya Ndirikle, Guam Daily Post.
Half a day, Governor. Half a day, Lieutenant Governor.
Half a day.
You both look extremely well today. I hope you guys are having a good day. It's certainly good news for the people of Guam.
We are. Thank you. And I'm smiling through my mask, so.
I can see it in your eyes, Madam Governor. So, ma'am, with respect to the vaccinations, there was a request, and I remember speaking to you about it at Ukadu High School last month, and you had wanted public health to request for an additional 45,000 vaccinations, thus increasing our monthly allocations for the COVID vaccines. Where are we at that with that request, ma'am?
The request actually has been very much heard in the CDC, the COVID team of President Joe Biden, and of course through the leaders of the team members. And so we have been increased we are now going to be getting a supply for March of about 32,000. I don't know the exact numbers. Maybe Art can update you, but we're close to our goal of 40,000. So the Biden administration, as you know, Oya, if you're following national news, that their biggest focus is to increase supply of vaccine to all 50 states and also to the territories. And they are aggressively working with Pfizer, Moderna, and now they're looking at Johnson and Johnson to be able to increase that supply. So we have gotten an early supply of about 14,000. We were increased to 17,000, and now we will be getting about 32,000.
And do you feel confident, ma'am, in the goal to reach some level of herd immunity by this summer, by Liberation Day?
Yes, I feel very confident that we will meet that goal. For
And can
several
I just-
reasons, we have
Okay.
increased our efficiency on providing the logistics for the vaccination administration. And our only limiting factor here, Oya, is of course the supply. And we are on our way to get the needed supply to meet that goal. And I just want you to know that General Perna and his staff are very aware of what our strategy is and what our goal is. And they are very supportive. So they are working as quickly as possible to help us meet our goal.
Ma'am, can I just squeeze in one last question here? There's been, we've spoken to a number of people, and the age groups, I would say above 60, 65, they were, all gung-ho about getting their vaccines. So we had a very high, I think Dr. Cabrera called it a penetration rate for those age groups. But we see a decline in the percentage of people who are getting vaccinated as, in the smaller age groups. What is the goal to maybe, and certainly this is not a problem that is, that only Guam faces. We're seeing similar reports coming out of many jurisdictions across the mainland and even in the military. But what is the strategy, at least for here in Guam, to kind of get more people comfortable with the idea of getting vaccinated, particularly those who are, as I said earlier, in the younger age groups, who are kind of either in the, I'm going to wait and see, or I'm going to, have my body create its own immunity to this virus.
All right. So our strategy continues to be education. Our strategy continues to be messaging from our experts as to the importance and the positive results and the benefits of being vaccinated, not just for the individual themselves, but also for the community. So our strategy remains to be focused and a very aggressive education messaging campaign, and also to be able to provide, again, the necessary vaccination sites. So we want to make it as easy as possible for people to come in and get their vaccination. So that's our strategy now, and I think we are starting to look like it's working. Of course, we haven't, Oya, gone down to the younger generation. We are still, I think, at 55 and above, which is, we are way, way, way ahead in terms of CDC guidelines in the other states. Some states are just starting their 65 and above. So as we continue to vaccinate people, and as people respond very positively to it, and we are seeing the penetration into those ages, we will gradually, again, look at lowering the eligibility age to, of course, 16 and above is what the vaccines and the experts are saying to vaccinate people. And of course, they are doing studies also about children. And once those are rolled out and given the guidelines, we'll certainly do that. But as you can see, our age group that we're really focusing right now is 55 and above.
Thank you, Madam
Thank you,
So we
Oya.
haven't really seen, Oya, the number that you're talking about young people not getting vaccinated because we're not at that age group yet.
Thank you, Oya. Nestor Lacanto, KUAM.
Thank you, Crystal. Hafa Governor and Lieutenant Governor. Now that it seems like the COVID pandemic issues are well under control, I was wondering if we could maybe shift to economic recovery, which I think is the other big challenge that's facing you. Congressman St. Nicholas held a press conference last week to announce some of the things that are going on with the Congress, $661 million for your administration, continuing the PUA and FPUC unemployment assistance, and a couple of windfalls. I think 100% repayment of EITC and the child care tax credit. I wonder if you can elaborate on those, how that will benefit the economy in the short term, and just speak about your plans for economic recovery into this fiscal year and beyond.
Okay, thanks, Lester, for that question. I just wanted to, again, bring you back to some history in terms of economic recovery and public health recovery. And as you know, when we started this pandemic, that I think both recoveries are very compelling and they're equal, but public health was much more the greater equal of these two. And so we focused a lot of our efforts into public health safety, public health protection, et cetera, et cetera. I also want to let you know that from the very beginning, we have always brought along the business stakeholders in our economic recovery plan. A lot of them wrote their own protocols for their various industries, and they were right there with information and with helping with the decisions of going from PCOR1 to PCOR2 to PCOR3. So the federal government, as you know, is going to have a third package called the American Rescue Plan. And I think it's making its way through Congress, and I'm very hopeful that it would be signed by the president, as he's very much a strong proponent for it. Those financial assistance, of course, will greatly help our economy. And I have already asked my fiscal team to look at prioritizing where we are going to put those financial resources. And because it would be allowed to use those resources for lost revenues recovery. And it's very broad. Any kind of events or issues or concerns that have been caused negatively because of COVID. So, like we have done with the first and the second package, we are going to, of course, infuse a major source into the economy, to the small businesses, to individuals, to nonprofit organizations, to the government agencies, to make sure that we continue providing the basic services that our people so greatly deserve. So that is our plan. We are right now looking at prioritizing. We will, again, be helping out financially through these financial aids. And of course, tourism is one of the biggest one that we will be helping out in terms of its lost revenues, and other agencies that, are very much targeted to our economy.
All right. A bit of a political question. Your reaction to a bill by Republicans that would require legislative approval for extending a public health emergency was amended by Majority Leader Nelson to the first 90 days, and then you would come back every month after that if you plan to extend it. Would you sign a bill of that sort?
Absolutely not. It doesn't depend how long it takes. You have heard my comments out there in the public, Nestor. I'm very adamant about this. This is a very dangerous piece of legislation. It's totally irresponsible. The provision to allow termination of public health emergency is already a law. It's already a law. And I guess when I was watching the debate, several of the senators there asked, why hasn't anyone evoked that provision? And they didn't because they knew that we are still under a public health emergency, and they knew that that is an executive branch authority and responsibility. So I've made myself very clear. It's totally irresponsible. It's dangerous legislation. You know how quickly the legislature cannot move. And to even say 90 days, I don't think they should have. Uh, I don't think that they should have the authority to renew this public health emergencies every month. And I think, as Senator Clint Rigel had said, the same three senators that authored this legislation also authored for a part-time legislation to come in every 2 years. So how can you do that and then require a legislature to come in every 30 months, every 30 days or every 9 days to monthly control the public health emergency? It's just totally, again, totally irresponsible.
And really quickly, Governor, do you intend to continue these monthly public health emergency declarations for the foreseeable future?
Well, I will continue doing it as long as I think it's necessary. And, again, guided by advice from the medical community, from the science community, from data and what's going on around, because we are very much impacted by what's going on around our island. I also want to say, Nestor, that in order for us to get these financial aid, we have to be a declared public health emergency. And by law, the individual that does that is the governor of Guam, not the legislature.
Thank you, Governor.
Thank you, Nestor. Jerry Partito, PNC.
Yes, thank you. Governor, we understand that Congressman San Nicolas is in town. Have you had the chance to meet with him and discuss this federal aid package that is in the works? And
We are working to have a meeting. And I just want you to know that we have been in communication all along about this package.
Okay, can you comment on what he said in his press conference that the government, that Gov Guam should not waste this windfall that is coming from the federal government? That's what he said.
I don't know what he said about Gov Guam wasting the windfall, but I do want to assure you, Jerry, and the people of Guam, that we have never wasted any of the financial aid that has been given to us by Congress and by the United States federal government. You can see we have been very transparent with the use of these monies. We have budgeted, we have made our budget and very visible. We have put the monies into the hands of our people, and we have put that in the way of direct grants, in the way of providing vaccinations, in the way of providing testing, in the way of providing uh, support and protection for our people, in the way of providing healthcare necessary for our people, for their lives to be saved, in the way of providing public safety for our people. So all these monies have gone right back into our people's hands and into all services that are necessary to protect the lives of our people and to continue with the quality of life that we deserve.
Okay, Governor, we've been getting complaints that some of the private clinics who are, designated to give the COVID vaccinations are turning people away and saying that they're reserving their vaccines for their regular preferred regular preferred patients. Are they allowed to do that?
Private clinics are allowed to do whatever they feel is within their parameters of delivery of healthcare services. Our role to the private clinics is to provide the vaccines and to provide the guidelines and to make sure the requirements are done and to make sure they comply to the reporting and so forth. So whatever they decide, that is their decision, and whether they do it because they want to make sure that people that people get the second dose, that's not within our authority, Jared. That's theirs.
Okay, ma'am. One last question: is tourism reopening still set for April? And also, the Guam Visitors Bureau has been informed that Japan and some of our other source markets have been developing their own vaccines and COVID tests. Now, will those vaccines and tests be recognized by Gov Guam when tourism reopens and when they come back to visit our island?
Maybe I'll have Art answer about the vaccines and the tests, but I just wanted to say that again, our strategy is to look at modifying travel protocols of for quarantine, and we're targeting to look at that by the middle of April, end of March, and to see based on what the metrics are and our COVID spread is how we are going to move forward with it. I just also want to say, Jared, that tourism will be successful when all our other market areas are ready to travel, and those market areas within themselves are also requiring quarantine, and they're not yet, I think, ready to travel. But once they are, we will of course promote our island destination as a place that's safe and as a place to come and visit. And so Art could probably mention about those other vaccines and testing.
Thank you,
Thank you,
Governor.
ma'am.
Yeah, with regard to the other types of tests, Jerry, what we're looking for right now when you arrive on Guam is a negative PCR, and that's our standard right now upon arrival. So any other type of test would be reviewed by the department and will be in consultation with Dr. Cabrera, our chief medical officer, and other members of the department. It can also be vetted through our physicians advisory group. And going through that medical aspect, we will then determine if that type of test is acceptable if it's not a PCR. In terms of vaccines, the same approach would be used. If it's not one that is recognized that we accept here on island, we want to review the type of vaccine that is being used in that country to ensure that its effectiveness is in standard with our CDC requirements and meets the standards of practice here for Guam to ensure that we continue to protect those who visit Guam as well as those who live on Guam for those that are visiting Guam. Thank you.
Okay, thank you, doctor.
Thank you, Jerry. Luella, K57.
Yeah. Actually, I'm also from PNC, but also I guess I represent P7 now. But I have a question about the new COVID-19 strains, and there was a report we were sending samples off island to CDC. So far, what is the status of the monitoring process? I guess this is for public health.
With regards to the strain,
Yes, the COVID-19 strains, the
yeah,
tests that we've been sending out for off-island tests, and are we
right.
continuing this? Yeah.
Right. So 20 samples were sent to CDC, and we expect the results next week. We have not received the results as of this time, but we do anticipate those results coming in next week, of the 20 samples. And 10 samples were from our community, and 10 were from our quarantine facility. And so we don't have those samples just yet, the results of those samples. And once they become available, we'll definitely share it because we are just as interested as the rest of the Guam community in terms of if any of these variants are here on Guam. And we're really hopeful that the answer is that they are not here.
if I could add to that, just real quick, just an update for everybody that on February 10, we did send out a second shipment of 20 samples as well, 10 from the community and 10 from travelers. So we weren't going to wait for the results of the first round. We already sent out a second round. So overall, we have 40 samples that are pending at this point.
I see. What do you think? Do you have like a, I guess, can you, what do you think is, are we prepared just in case something like this happens, like one of those tests turn out positive? So is Guam prepared to deal with those? Is it?
Sure, I'll take that question. So, basically, I know we're talking a lot about, with PCOR3, our transition now, and then also looking into the future in terms of reopening tourism or more travel with less restrictions overall. We have to really recognize where we are at the present, and that right now our risk tolerance for introduction of travel-related COVID is very, very low to zero. And so because of that, and because we're opening up more and there's going to be more activity and less mitigation overall, even more so why it's important that we shore up our quarantine process right now. So at the current time, we're looking at different ways to continue to improve it. And that's why it's very important because of these strains in particular. So, if the sample shows that that one of the travelers had one of the variant strains that are of concern, then that's actually a good thing that we caught it in quarantine. It means quarantine works. So that's the key part there. And these samples span mostly from December and January as well. And so what's also going to be important is it's actually probably not going to be as scary if we actually know that one of the variants are actually already here. And if there are a sample from, like, let's say early January, because that means we've controlled it at this point. So that's a key thing. So I don't think it's something to panic about. I think it's more of that we have to recognize where the sample came from and that if it's already been mitigated. But what we're seeing definitely is that with this increased infectivity and now potential for increased morbidity and mortality, in particular with the UK variant, that causes great concern. And if it becomes a predominant strain on this island, then our goal for herd immunity has to be raised up for it to be effective.
Thank you. And I guess one last question. I'm so sorry about that. But so is there are we expanding, I guess, our options for vaccines, like for, I guess, are we getting AstraZeneca or Johnson & Johnson vaccines in the future, just to further expand our supply or something like that?
To the question with Tess. Okay. To your question, actually, our vaccines are supplied to Guam through CDC. So only those vaccines that are authorized through the CDC review process and approved will be the vaccines that Guam will receive. So right now we've got the Moderna and the Pfizer. Those are the two authorized vaccines that are sent to Guam. And if any other additional vaccines like Johnson & Johnson is approved or any other vaccine distributor is approved, then those two could be extended and will be extended to Guam.
Thank you. I have no further questions. Thank you.
Thank you, Luella. CJ or Kiko, Pacific Island Times.
Half a day, Governor. Half a day, everyone. It's a big day declaring PCOR3. Congratulations. My question, I've noticed and I've heard and I've experienced firsthand vaccinations happening at UOG and DPHSS, National Guard, tireless Dr. Hattori Uchimar doing a phenomenal job. Are we on track to receive the 30,000 vaccines for March? Is my first question.
At this time, all indication is such that we are on track to receive the 30,000 plus vaccines in March. We have no indication at this time that it is not going to be sent.
Great. And this one is about the nightlife industry. I'm sure it's a relief for owners and employees that there's an opening date. They're probably just wondering why the delay until Wednesday, I believe February 24th, right? It's a reopening of bars and taverns.
You are correct. Oh, why the delay?
The target date of the 24th is going to allow Public Health and Social Services to continue the review to put forth the guidance in line with our legal review. So there's just a few more steps we have to take before the guidance is officially issued. Nothing more than that.
Just wanted to add to, and that we had gotten the protocol guidelines from GHRA on Tuesday, which is that was 2-3 days ago. So we are in the process of reviewing it, but additionally, the guidelines needed to be updated, and we needed to also incorporate some of the suggestions from the other bars and taverns. So it's going to take us a while, maybe a week. We're giving ourselves a week, but we are on the process of reviewing it with public health and our legal.
That's all I got. Thank you, Governor, everyone. Congratulations again.
Thank you. Let's go around one more time. Maureen, do you have any follow-up questions?
Yes, I do. I'm not sure who would take this question, but it's about the vaccinations. So right now, we're looking at the sectors of our population that are over 55. So how would you do the group after that? I mean, you couldn't open it up to all the general population if you wanted to, right? Given the numbers. So is that going to be from 40 plus, or are you going to go geographically? How would that work next?
Sure, I'll take that question. So, so again, we have to remember what is the primary purpose of the vaccines. It's to reduce or eliminate death and also hospitalizations, and basically, and that's what the data supports of what the vaccines do. It decreases moderate to severe illness with COVID. And so that being said, we are comparing. We've been consistently comparing with, first of all, the deaths, right? And so we know that here on Guam, there is a significant jump in your risk of death from the age 55 and up as compared to younger. And so we were inching back toward 55 as the supplies allowed us to do that. So now what we've been looking at as well is the hospital burden in terms of hospitalizations. And so the way that we've been viewing this is in terms of hospital days per age group. And so what we're seeing is that throughout most of the pandemic, about 87% of the hospital days were from persons 40 years and older. So you set 40 right off the bat, and that's not, and the numbers do support that. But the key thing is that if we were to go from 55 to 40, that's including now an additional about 30,000 eligible individuals. And so we have to ensure that we have the vaccine supply to accommodate that increase. But we are itching, so to speak, to reduce that down, because again, our main goal is to protect the hospitals, protect the persons from having to be admitted and ultimately potentially dying from COVID. So that's what we're looking at moving forward. But we want to be more sure that the vaccines are on ground before we can actually make those promises. But ultimately, this is a decision that's made by the Vaccine and Antiviral Priority Policy Committee. And so we'll continue that discussions.
So it might be in a maybe a 5-year age group, maybe 50 plus, then 45 plus, depending on what vaccine deliveries you receive. If the group is 30,000 plus people.
Can't say for sure, but that's reasonable.
Okay, just to have some idea of what people can expect, I guess. I wanted to also ask the governor. You just said that you were looking, assuming that 1.9 trillion bill that's creeping through Congress gets signed, and we do get our 661 million. You were talking about giving money out again to various groups, small businesses. Does that mean you would look again at at a GIDA system of grants for business, small businesses, nonprofits?
You know, we will again use the same kind of processes and the same kind of framework that GIDA is using for small businesses. As I think that would be make it a lot more accessible and easier to again continue this small business grants for businesses.
Okay, so since we're on the subject of small business relief, and you and Crystal and everybody have kindly given us a bit more time, there's a number of bills making their way through the legislature, as I know you're aware. Board signing. Would you like me to be more specific, or can you?
You lost. I got lost in.
So there's a number of bills that are going to end up on your desk, right? By the sound of it, depending on exactly how the votes go. So are there any that have economic ramifications for small businesses that you are leaning towards signing?
You know, I don't really commit to those questions because I want to give myself the opportunity to totally look at the bill and to look at what other kinds of analysis have been done to support one way or the other. So I have always not committed to any of those questions other than to say, as it gets to my desk, I will review them and I will look at what, you know, arguments and supporting cases towards it.
Okay, so let me move on to ask about retail outlets and malls. I mean, we're making plans for the return of tourists. We know they love to shop, as do our residents. We seem to be coping with the number of people who are going to the malls and retail stores and restaurants for that matter. So when do you see opening those up more?
Executive order would allow the occupancy increase from 50% to 75%. And that's what we're doing. For the stores, for the retail stores. For the dining in, we are going to, I would like to keep it at 50% for now, but for retail stores and outlets and so forth, it's 75%.
Okay, and you don't see that changing for a while? I guess not.
To making it completely, totally open?
Yes.
You know, when we go to PCOR3, that's definitely what those guidelines say. Everything would be totally open.
Okay. All right.
Thank you, Maureen.
What I have for the moment. Thank you very much.
Steve Limtiaco, do you have any follow-up questions?
Yeah, I just want a quick question for public health regarding the reopening of bars. I know you're still working on the specific guidance, but can you comment at all on what some of the basic ground rules would be? For example, can bar patrons get their drinks at the bar? Or is it going to be table side? Have you thought about that?
Hello. Test. With regards to the question you have, Steve, actually, that's actually right now what they're refining is actually to define that exact question that you've asked, whether it's going to be at the bar, is it going to be seated, similar to restaurant operations in which you have a party of 6. We're looking at maintaining, for example, 6 feet distance between parties. And still, those are things that are being reviewed at this time. Some of the standing parts you're always going to have in any operation like this are, you know, wearing a face mask, maintaining a registry of guests, and those are also being considered. How practical would that be at a bar setting, at a tavern setting? So we're looking at that not just for the public health component in terms of ensuring that we can do contact tracing and case investigations if we need to, but also what can be operationally functional for that company to do business. So we are looking at that in terms of the question you raised, but we don't have a definite final answer at this time. It is being reviewed and considered at this time.
Okay, thank you. No other questions.
Thank you, Steve. Any follow-up questions, Oya?
Yeah, Madam Governor, we can go back to the vaccinations and the the next group of folks. We've seen over the last month or so additional groups of people getting added to those who are able to get vaccinated. And there's a group of people that we've spoken to over the last year. These are our grocery store workers. These are our gas station attendants. These are folks who have a high level of contact with a huge number of people in our community on a daily basis as part of their regular jobs. And I was wondering, are they being considered as a group being added into, as opposed to, I think what Maureen was talking about, as opposed to looking at ages, but looking at these specific groups of folks with high contact?
Oh yeah, yes, actually the VAPPC committee, the group that Dr. Cabrera mentioned earlier, that group was actually raised, that group and is being considered. But right now for this month, the focus of the group has been, their decision has been to focus on second dose. And so as more doses become available, those groups will be brought up again for consideration by the vaccination committee. But they have been discussed already and are in the radar of the VAPPC.
Can I ask, I mean, if you can provide some insight into the VAPC with respect to the last group of folks who were added were senators, and of those senators, I believe that 5 or 6 do not fall under the age group qualification. So what was sort of the thought process behind that?
Well, the different thought process we have, for example, was leadership in the operations of government. We had authorized, for example, the inclusion of our mayors, given their contact with the community and their staff, right out there front and center, helping our community. And then the next step we took as a committee was consideration for the senators, the 15 members of our Guam legislature. It was not extended to their staff. It was just extended to the elected officials at the Guam legislature. And really, it's just the leadership of government, our legislative branch, executive branch, and judicial branch. And that's how the committee had moved in that direction for the continuity of government overall.
Thank you, Art. Madam Governor, if I can kind of follow up on Maureen's questions. She had asked about how you feel about some of the bills that you'll be facing. One in particular that I wanted to ask you about is the minimum wage bill. Are you inclined to sign that, ma'am?
The minimum wage bill hasn't been on my desk yet, but I am reviewing it. And as I have said earlier, I'm weighing out all the considerations, to help also support the small businesses, but to also make sure and assure that our people will be given advantage of an increased minimum wage. So although it is a delay, it's not really saying no minimum increase. So Oya, again, I am going to review the bill. I have not really seen it, although I have been tracking it, but I'd like to see its final version.
Got it, ma'am. And can I also ask you about your feelings regarding the Bill 1, which is actually being discussed, probably being discussed as we speak, which is Senator Tina Barnes' bill regarding BPT. And I think at least one of your directors has spoken not in support of it. So I just kind of wanted to get your take on those bills. And
can you explain? Can you explain which bill exactly you're talking about?
So Bill 1 is former Speaker Tina Munoz Barnes's bill, and that bill would allow that would reduce or allow businesses to not pay BPT for a certain amount of time, a temporary measure to help them for a minute.
I'm not aware of that bill. Sorry. This is the first I've heard.
Yeah, it hasn't been passed yet, but it's being discussed. And I think Director Shimizu had gone on the record saying that she did not support it.
I am not aware that there's a bill that former Speaker and now Vice Speaker Tina Munoz Barnes has put forward that, what did you say, totally removes BPT?
Oh, no. It would just temporarily, they wouldn't have to, certain small businesses wouldn't have to pay.
Oh, it's not BPT.
It's not BPT?
It's business license waiver.
Thank you for that, ma'am.
Right? It's business license waiver. Okay.
Your thoughts on that, ma'am?
I haven't seen it. I would definitely want to see what kind of impact that would do to our general fund, and see how that would, roll out in terms of our ability to also get the revenues that we need to provide the basic services of our community.
Thank you, Oya. Nestor, do you have any follow-up questions?
Yeah, just wanted to kind of just sort of wrap up. Governor, obviously you're confident that enough to go to PCOR3. Was there any specific turning point for you, or was it the overall metrics? And just as a follow-up to that, is there a scenario that would prompt you to reverse back to more restrictions, and how quickly would you do that? Thank you.
I think the turning point for me, Nestor, is the vaccination. And when I saw how quickly we were able to vaccinate our people, and the response of our people wanting to be vaccinated. Additionally, it also, so that was a major one. And so with our strategy of test, contact trace, treat, and vaccinate, those are very significant sources of treatment and strategy that only strengthens community, the containment of the virus in the community spread. So that's basically the events that have happened that I feel very comfortable in to move from PCOR2 to PCOR3. If we were ever to again surge like we did in August, where we saw 276 positives go up to 500 the next day, over to 1,000, yes, that would require quick action and a quick return to PCOR1.
Thank you, Governor.
Thank you, Nestor. Jerry, do you have follow-up questions?
No more questions. Thank you.
Thank you, Jerry. Luella, do you have any follow-up questions?
No follow-up questions on my end. Thank you.
Last but not least, CJ or Kiko, do you have any follow-up questions?
I'm good. Have a great day. Thank you.
Thank you so much. I would like to give the floor to Lieutenant Governor Josh Tenorio for some closing remarks.
Thank you very much. I just want to thank the community, our people, for all of the things that they've done to comply with the measures to really embrace and take seriously the situation at hand. We see throughout the country and in many parts of the world where communities did not heed that advice and are in a worse way. And as we continue to relax and phase in this return to this new normal, this is a very vulnerable time for us. Although the numbers look good, remember that the virus is still out there. And so I just say that as you take steps to return to socializing with your family and your friends and meet people in the workplace, please know that the virus is still out there. And as we saw in August, things can spiral very much out of control in a very short period of time. So I'd just like to ask everybody just to be mindful. If you feel sick, stay home. Stay home. Do not risk yourself. Do not take that risk, and don't risk others. And finally, I just want to thank the school community. I would like to thank the schools, the college, the university, the private schools, the charter schools, the teachers, and the school staff for beginning to embrace this phased-in return to school. It's such an important time. Our children, our students have lost quite a number of time in school days, and it'll be our mission with the educational partners to find ways to recover that time. After hours, after school, in the summer, I think you could expect some programs and support so that students and parents are able to try and catch up on all the time. But I also want to recognize the hardworking staff of the Guam Department of Public Health, their partners, the volunteers that have been coming out from the medical and dental community, our men and women of the Guam National Guard that have led the way and have shown us and actually shown the other guards really what an efficient, effective operation can be and the success that can come along with it. Also, the frontliners and the staff that never went home, those that work in those grocery stores, the mom and pop stores, hardware stores that have been there to make sure that we try to have the comforts in our daily life at home. We really salute all of you. And at this time, I'd like to pass it on to the governor. The governor now will be signing Executive Order number 2021-04 relative to declaring Pandemic Condition of Readiness 3 or PCOR3.
Today we have a a CAR score of 0.1. The last time, July 21st, was it? 2020 was the last time we went into PCOR3. So I think this is a remarkable progress for us and very much encouraged by this CAR score of 0.1. Thank you again, and please do not relax those measures of wearing your mask, social distancing, washing your hands, and staying home when you are sick. Thank you.
Thank you for joining us for today's press conference.